Well, let's continue now to unpack the struggles caused by these blackouts. I'm joined by the South African Medical Association's Vice Chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, welcome to today. Thank you for joining us here on eNCA. All the way there, you are in Durban this afternoon. Now we've seen and we are seeing, in terms of our reporters on the ground, for example, the impact of load shedding on water supply. I guess hospitals are also suffering at this time.
Hi, Braden, and good afternoon to your viewers. Thanks for having me in your program. We are really feeling the pinch in the healthcare sector as well. As you may be aware, some of our hospitals have a problem with generators that don't kick in on time. Sometimes they don't kick in, for some time, or they're not working at all. And the other thing is that we have incubators, that at times they use batteries and all those things, but incubators are not working. Sometimes they get damaged because of the electricity being on and off. So those are the challenges that we're facing, and that it impacts negatively. It may at times lead to death of patients. We are not sure if there are any deaths at the moment, because what we are doing as the South African Medical Association is we're embarking on a survey to make sure that we quantify, the impact of this load shedding.
Yeah, so I mean, it's just not one aspect, I guess, of the health sector or health work that is going to be affected. You've mentioned, for example, incubators, I guess, ICUs and operations as well, in terms of important surgery that needs to be done, and a number of other treatments have to be pushed back depending on when a hospital might have power.
The greatest problem, Braden, is the emergency operations that you cannot postpone. It needs to be done now and now. So if you have an emergency operation and you have a blackout and your engines cannot kick in, it means that the patient is going to die. So that's how, this is impacting areas like theaters, in the hospitals and stuff like that. I mean, imagine you have a patient who's already on the table and there's a blackout and there's no kicking in of the generators. It causes huge problems, for the healthcare sector. And that leads to, obviously, escalation of these litigations by communities to government.
Yeah, so I'm just from a medical association side, I mean, your members and doctors and hospitals, people might really be feeling very, very much frustrated, because in addition, if you're in private practice, for example, you're a doctor, or your private clinic, there's an additional cost now to energy. You might have to get a generator. If you do have a generator, you're spending thousands and thousands in diesel costs. So on top of just your normal operations, you are now landed with a pressure of energy costs.
I mean, there's a colleague of mine who was showing me a receipt where, he's paying about 15,000 a week for fuel. So you can imagine the impact. You need to have a generator, but you need to put in petrol or diesel in that. You obviously have to check your equipment as well, because at times this equipment is affected by the switching on and off of the electricity, so that it damages computers and everything else. So those are added costs, to what we're experiencing at the moment. So you are spot on. It affects those also the doctors who are practicing in the private sector as well, not only in the hospitals, but those who are standalones, and running their practices. So it's really impacting them negatively.
Yeah. The other point is there's a future here. We're not sure what the cabinet and President Ramaphosa are meeting this afternoon in Pretoria are going to come up with. So many other plans seemingly are not working. ESCOM is just a big mess. It's the future, because hospitals now, doctors as well, people are going to have to invest in alternative energy sources, and meantime patients are suffering.
This is a huge problem because, like you said, if you are practicing, for example, in the private sector, it will take time for you to generate such funding, to be able to implement such alternative energy sources. But also, if you are working in the state, I mean, the death of patients is what really concerns us. When you have emergencies, when you are attending to theater patients, when you are, having those premature babies who need to be attended to, you really, you don't want those babies to feel cold. But if you cannot obviously make sure that there's alternative arrangements, when there's a shedding, load shedding, then we have a problem. That is why there's a call by my colleagues. Prof. Mohammed has come up with a petition to say that, spare hospitals with this load shedding. There must not be no load shedding when it comes to hospitals in the country, in all the provinces, because we cannot afford to have patients dying. I mean, if we have politicians having lights at their homes and their streets, and they continue to enjoy moments of no load shedding, why can't you do the same with the hospitals? Who is important here, a dying patient or a healthy politician?
Very interesting point indeed, a very important one as well. Thank you very much, Dr. Mvuyisi Mzukwa. He's the Vice Chairperson of the South African Medical Association, just sharing with us the experiences currently in the medical sector on the impact of the ongoing load shedding, the blackouts by Eskom. Okay.